Full body, multi-wave LED light therapy. An incredible opportunity. LED light therapy is a completely non-invasive tool that people are using to energize, detoxify, and nourish portions of their physical body. Originally used for pain relief and wound healing, the researched benefits are growing with each new study. In this video, we will share a high-level overview of what researchers suggest are the molecular changes that occur with LED light therapy. These molecular changes create the basis or root cause for the cascade of benefits that show up in tissues, organs, and finally the entire body. This video is designed to present a novel new system which illuminates the entire body with multiple wavelengths of light energy. Most, if not all, research to date has been focused on a specific injury in a specific location. The hypothesis is that the benefits of full-body LED light therapy are synergistic, driving greater levels of wellness and higher potential for peak performance training. Historically, LED light therapy really came into prominence due to the research done by NASA's Marshall Space Flight Center. In 1996, they began publishing studies on wound healing capabilities of LED light therapy. Since then, medical researchers have added over 200 randomized, double-blind studies. Note that the research we post here is mostly taken from the National Institute of Health website. Here is a summary from one study. The LED produced increases in growth of 155 to 171% of normal human epithelial cells, improvement of greater than 40% in musculoskeletal training injuries in Navy SEAL team members, and decreased wound healing time in crew members aboard a U.S. naval submarine. LED produced a 47% reduction in pain of children suffering from oral mucositis, sores that develop in the mouth and throat of children undergoing chemotherapy. Researchers later used the LED to simply prevent the sores from developing, thus reducing the level of suffering children undergoing chemotherapy experienced. Conclusion: we believe that the use of NASA LED for light therapy alone, and in conjunction with hyperbaric oxygen, will greatly enhance the natural wound healing process and more quickly return the patient to a pre-injury illness level of activity. Again, understand that the current research is primarily, if not exclusively, based on dosing a specific treatment area affected by an injury. Our mission is to present an overview of these studies and pose a question. Why not expand from a localized, injury-focused treatment out to the entire body in a single treatment, and what would be the benefits? Essentially, you have what might be called a photon cleanse. The energy of light, or photon, is absorbed in the cell's chromophores. Chlorophyll is an example of a chromophore in plants that absorbs photons from sunlight, which sparks the energy-producing process of photosynthesis. The chromophore that seems to best absorb photons in the human body from LED light therapy is cytochrome C oxidase, located in the mitochondria. Mitochondria are the cellular power plants that convert food molecules into energy in the form of ATP via the process of oxidative phosphorylation. It is postulated that the photons from the LED hit the respiratory chain in the mitochondria and break loose those reactive oxygen and nitric oxide. Oxygen then rebinds to the site, stimulating ATP production, which is used to energize the cells, and through that, the entire body. LED light therapy seems to increase both ATP production and increase production of more mitochondria. This is a profound statement when applied to the largest organs in the body. You're creating more mitochondria and increasing the mitochondria's capability to produce energy. This increases cell growth and slows cell death. One of the key motors this increase in ATP turns up is in the cell fibroblasts, which are responsible for the production of collagen and elastin. As we age, we tend to produce less collagen, which creates thinning skin. Collagen production is increased substantially with LED stimulation. A German study in 2008 suggested that the #1 skincare benefit of light therapy is its ability to help the elastin layer return to its original glue-like nature. This is a key factor in LED's famed anti-aging activity. If you can tighten and thicken skin, then it follows that you can slow, stop, or even reverse the aging process. A second reaction that LED light therapy creates is the release of nitric oxide. In 1998, 3 researchers were awarded the Nobel Prize in Medicine for their research on what is called the miracle molecule, nitric oxide. Nitric oxide production seems to be one of the main mechanisms leading to the benefits researchers are discovering for LED light therapy. Research suggests that the photons from visible and infrared LED light therapy create nitric oxide via 2 pathways highlighted below. 1. Visible light stimulates the cytochrome C oxidase on the mitochondria respiratory chain into a reaction that releases nitric oxide. 2. Infrared light is absorbed in the cell wall, which affects the sodium-potassium pump with an increase in nitric oxide production. Some of the key benefits researchers have posted from localized LED light therapy include increased ATP production. ATP is the body's energy currency. It is created in the mitochondria. Increased biogenesis of mitochondria. Biogenesis means creating more mitochondria, which means the LED not only increases the output of ATP, but it increases the density of mitochondria responsible for producing the ATP, which also produces more nitric oxide. What effect might this have when applied to the skin and muscular system? Reduced inflammation. Inflammation is cited as the leading cause of 7 of the top 10 mortality-causing diseases. If you can reduce chronic inflammation in 2 of the largest systems in the body, what might be the effect? Muscle and joint pain relief. Detoxification of waste and free radicals. Release of nitric oxide, the miracle molecule. Increased circulation and nutrient transfer. Reduce blood pressure and relax arteries. Increased cellular growth and slowed cellular death. Increased collagen and elastin synthesis. This is the anti-aging benefit. Repair of tendons, ligaments, and connective tissue. Huge application for athletes and injured. Angiogenesis. Building new arteries, which leads to increased circulation, which expands the benefits listed above. Nerve fiber repair and genesis. This is an exciting discovery. TBI, or traumatic brain injury, seems to respond to LED light therapy. This might be a solid tool for athletes and military veterans alike. There are more benefits, and with over 200 studies posted, researchers are universally calling for an expansion of studies to learn more about potential new benefits. The key takeaway is that LED light therapy seems to create conditions within the cells that help the cells get healthy. Holistic medical pioneers like Dr. Whitaker suggest that when you can help the cell restore to its original healthy nature, the downstream health of the tissues and organs improves. These doctors suggest that this root cause approach can lead to recovery from illness, injury, and disease that traditional medicines might fail to help. Could the full body photon cleanse initiate a chain of reaction, cascading into greater levels of energy and wellness? One study on LED light therapy showed that by shining the LED on the underside of the body of rats that had an incision on the top, the injury on top improved without direct stimulation. The question that we're asking researchers is, what would happen if LED light therapy was not simply applied to injured areas, but rather to the whole body? We know that from the mucositis research by Dr. Whalen that LED light therapy is preventative. It was used to prevent chemotherapy sores from appearing in the first place. So where exactly could this lead to? Of the 10 leading causes of mortality in the United States, chronic, low-level inflammation contributes to the pathogenesis of at least 7. These include heart disease, cancer, chronic lower respiratory disease, stroke, Alzheimer's disease, diabetes, and nephritis. If LED light therapy reduces chronic inflammation in your muscles and skin, the largest organ in the body, then what might be the effect of a full-body LED light therapy system? If anything affects everything, then what happens if we reduce inflammation, toxicity, and free radicals while simultaneously increasing energy production, circulation, and nutrient transfer in the body's largest systems? What might be the downstream benefits of the accumulation of all of these? Could a regular photon cleanse be preventative medicine or even a pathway to higher levels of performance? An athlete relies on his body's ability to produce energy. circulate oxygen, and the speed at which nerve impulses travel. Athletic training is a constant process of stressing the body so it rebuilds stronger, faster, and more precise. Light therapy shortens recovery time and increases both the level and capacity of energy production. Studies have shown this for 20 years. If the photon cleanse improves and generates new nervous, circulatory, and energetic capacity, then what effect might a full body photon cleanse have on a well-trained athlete who's reached a peak in their performance? If this works to help athletes improve their peak capabilities, then what possibilities might it contain for a normal working person like you or me? Could the average person use more energy, better circulation, and lower toxicity? How many illnesses could be affected by these 3 actions? At the ARRC LED, we're searching for the answer to these questions in our own studies with some of the most respected physicians in the United States. Welcome to the ARRC LED, the Advanced Recovery and Rejuvenation Chamber. At the ARRC LED, our mission is to deliver the benefits of full-body multi-wave LED light therapy to the masses. The patent-pending ARRC LED comes in 4 models described below. Below this video are links to the research we just quoted. Additional research below is segmented towards specific health issues and links to the actual studies that are included so you can more deeply investigate the source and methodology. Please don't take our word for it. We have an incredible opportunity. As one of our clients called it, epic. Will this be your epic new service? If you're a medical practitioner looking for new ways to stimulate wellness with your clients, we encourage you to investigate this further. Then call us. We can work together to create a center in your facility to deliver this directly to the public for a fraction of the cost or side effects.